And I think one thing that separates us from other hospitals is that we care for the more vulnerable community. So homeless people, people with mental health, and that's something that's been part of the mission since the sisters started the hospital.
Probably one of the main drivers I actually chose to work at St Vincent's.
Every single patient gets managed in a way that you would want your own family managed.
Saving the vulnerable, being there for the poor, coming from St Joseph's background, it means providing palliative care.
That I'm practicing in a way that is in alignment with St Vincent's values.
Keeping the work of the sisters in everything we do. It's embodying compassion, our core values of justice, integrity, excellence and compassion every day at the bedside.
The managed alcohol program is a model that we've borrowed from Canada, where it was established to meet the needs of people who are homeless and alcohol dependent. So people are provided with housing, food and support for their welfare needs and their healthcare needs, both their primary care needs but also their specialist needs. They will be offered specialist addiction care for alcohol use disorder. And importantly, they'll be provided with alcohol on an individualised alcohol care plan that can be up to 1 drink every single hour during the day and 1 drink during the night as well. We know there's an important group of people who come to our hospital and our emergency department for whom the existing services are just not meeting their needs. So they're really falling between the cracks of what's available. Their attempts to engage in treatment or housing services have really failed. So the managed alcohol program really is looking at the gaps in the system and which people are not actually having their healthcare needs met by the current system. So this is very much within the mission in supporting people who are otherwise vulnerable or excluded from the current system.
So the motor neuron disease program at St Joseph's Hospital is a multidisciplinary team. So there's a number of medical specialties involved. You need to have a team that's very responsive to the patient because the journey is so variable between patients. Our motor neuron disease service does follow the patient journey from the very beginning, from the diagnosis. We also then do the entire disability management here at St Joseph's and also the palliative care and end-of-life care. So we follow the patient journey through the entirety. So motor neuron disease causes a lot of suffering. So it paralyses different parts of the body in different patients. It doesn't always progress the same. So the arms, the legs, the trunk, and also the muscles that are for speech and swallowing. So you lose your ability to speak, you lose your ability to swallow. People often need to have enteral feeding to manage them appropriately. And ultimately at the end, it is a terminal condition. It will paralyse the diaphragm, that's the breathing muscle. These patients are extremely vulnerable. Often in the demographics here, they don't have a lot of social support and they aren't wealthy. But even if they are, this condition itself is so disabling and disempowering that these patients are very vulnerable.